Hello, I am Lauren Rutgersen, and this is my career portfolio project two for this class. So I wanted to start by going over the ONET profile results that I received after taking that evaluation. They indicated that I had high interest in investigative, conventional, and social. So this did a lot to reassure me that I was on the correct path with my current career choice and helped guide me on where I wanted to go with my education. I do hope to obtain a bachelor's degree here in the future, but I am starting with an associate's degree. Um, this helped point me in the right direction of what career path would be the most beneficial for me and the best fit for the things that I excelled at and had interest in. I do enjoy my current position. I work as a health support specialist for WIC. In that position, I use a lot of skills where I collect data and I organize it, do reports. I'm client facing, so I do speak with clients and help coordinate their care and refer them out for additional care. I do enjoy helping people. I find that to be the most satisfying. So I think that satisfies my need for social. And conventional, working for the state is nothing but conventional. There is a strict set of guidelines and ways to do things, and I enjoy knowing what my path forward is in things in the tasks that I need to accomplish. This just was very great at reassuring me that I am going in the right direction. So a little bit more about these three strengths and how I felt that they pertain to me and how I receive them. The investigative analysis picked up on my desire to do research and collect data and continue to learn. I have always sort of worked in the healthcare field in one capacity or another. I initially thought that I wanted to be a nurse and discovered very quickly in that field that there isn't a whole lot of work-life balance, at least not to the degree that I really wanted in my life. So you know, figuring out my way with that strength of mine as far as social analysis. It identified my desire to help people. I had mentioned before that working for WIC has definitely satisfied that desire for me. I enjoy human interaction, client-facing positions to a point, and I enjoy really helping people. As far as conventional goes, same with my current position, working for the state, there is always procedures, policies, and specific ways to do things, essentially. So I do enjoy knowing what is expected of me, clear expectations, and how best to do things in order to complete the task in the way that is needed. With those strengths, I added the filter of my intentions to obtain a higher degree and the willingness, I guess, to do more training in order to obtain a higher paying degree. And it identified three careers that would be possible good fits for me. And for all three of those careers, I identified a degree that would be the best option for going in the direction of those careers. So the first career was document management specialist, clinical research coordinator was the next, and clinical data managers. For all three of those, actually, it would seem that a bachelor's degree in human information management would be beneficial for me to have and help me along on getting that degree or getting those careers. Excuse me. So, starting with a career in as a document management specialist. This is a career that is exactly as it sounds. It has a lot to do with the processing and handling of electronic documents, medical records included, which is something that I actually have experience in as I've done a lot of administration work in medical offices and now with the county health department. So I have entry level experience in this, and this was one of the top choices that aligned on the ONET profiler with my results in strengths in investigative, conventional, and social. It has a lot of hard skills. Software knowledge is a definite hard skill. Working with computer and being at it efficient at it, and knowing different programs like Microsoft and how to use all of those would be a definite hard skill, something that you need to do to be able to do a position like this. As far as soft skills, good communication, the ability to kind of problem solve, identify things that are not going correctly, and managing them and correcting them. Um, attention to detail is huge with all three of these careers, but definitely with this one. I had mentioned before that the bachelor's degree I felt that I could go for and obtain a career as a document management specialist would be a bachelor's in health information management. Um, some of the other skills that you would need in order to do a job like this would be reading comprehension, good active listening skills, absorbing the information that's coming in and turning around and putting it to good use. These are skills that I feel that I do possess and would be able to utilize. I do use them in my career currently, and I feel like this would be a transferable skill for me. Using information from the ONET profiler and websites like the Bureau of Labor Statistics, I was able to determine that entry-level positions for this career earn salaries between about $50,000 and $60,000 a year, while more experienced uh, salaries range of between $100,000 and $110,000 a year. Um, this is a job that is definitely on a computer constantly, a lot of record keeping and data entry, communication, and coordinating between different entities. This is a field that has no emergencies necessarily, so it has a really great work-life balance. So I do feel it would be a good fit for me. Moving on to clinical research coordinator. Research coordinators manage all aspects of clinical research programs. I chose this field as it was one of the top ones that aligned with my interest for the ONET profiler. Um, Job duties for this field include a lot of coordination of clients and different team members, interviewing and assessing eligibility for these programs. I have actually worked on clinical research programs in the past as a medical assistant in dermatology, where I kept records and submitted data and or coordinated patients for different cares and kept track of what went on in that clinical trial. So I ascertained that bachelor's degree again would be something that would be needed for this career field. The same one in health information management would be beneficial to have to obtaining a career in clinical research. This is a job that has a lot of hard skills, a lot of software knowledge needed, working on a computer, data collection and categorizations, and client coordination. Soft skills for this profession would be, good communication and teamwork, actively listening to each other and taking and identifying problems and solving them along the way. This aligns well with my strengths in investigation, convention, and conventional. Um, Entry-level salaries for this field range between 45 and $60,000 a year. I think that I have a lot of, prior experience that will be beneficial in helping me obtain a job in this field. The average salary for an experienced coordinator ranges around $161,000 a year. It does have a bright outlook and it is constantly growing. They are projected to grow about 8% in the next 10 years. And that was per the information from the Bureau of Labor Statistics. Day to day in this field, I would expect to work in a clinical setting or an office setting with clients and, with teams and coordinating them. I would expect to review a lot of medical records and working with physicians and nurses is a possibility depending on which industry I go into. For this one, pharmaceutical was big, had much higher pay rate and was hiring at a more rapid rate. Information I got from the ONET profiler. This is a job that does has little to no emergencies, so it would have good work-life balance and would be a good fit for me. So the third career was a clinical data manager. This is a job where it involves collecting and management of different data, and it seems to be a job that would be most in the healthcare field. I feel that this again would align with my interests. The ONET profiler indicated that this is something that would fit best with my interests and my desire to, grow and continue to get my bachelor's degree. Duties in this field are, pertaining to a lot of data management and utilizing softwares on computers to manage all of that data. This is soft skills for this job would be a lot of problem solving, communication with patients and working with them, a lot of client facing work. Um, Creating policies and procedures would be something that is also involved in doing a job like this. It fits really well with my strengths in investigative and conventional. The entry level positions for this career actually start pretty high. I don't know. I do have some, entry level experience, same as the other two, since I've worked in healthcare settings. I don't know that I would be able to start at that salary, but I think with a degree, I would be able to come close. So the annual salary that they projected was about $112,000 a year. There is a bright future in this career path as well. It requires a lot of attention to detail, though, a lot of paying attention, identifying errors when they are there and fixing them, and following different procedures and protocol. As I had mentioned before, my degree path is to obtain a bachelor's degree in health information management. I'm first starting with obtaining my associates, which I plan to complete within the next year, and then move on to working on my bachelor's. This is something that would typically take somebody about 4 years to complete. I am attending college on a state voucher program, so this will probably take me quite a bit longer as I am taking about two classes a semester, as that's what the voucher covers, and that is what my schedule allows. I work full time and I do have two children and I'm married. So all of our schedules, it's a lot. But doing this online is an option for me, and I plan to do as much as I can in that way, as it would be the most beneficial to me and my schedule and how I'm working currently. This is a job that I can work in the pharmaceutical industry and potentially earn a high salary. I would also have the option if I wanted to work in a hospital or healthcare systems or a government agency, which is what I currently do. It's a highly customizable degree that can be used to specialize in fields related to clinical research. So, my thoughts and just sort of recapping some of the things that I have mentioned in my project. I currently work for the health department. This career path that I'm on does satisfy my interests and strengths in investigative, conventional, and social. I do have room to grow, and it is helping afford me an education so that I can get my bachelor's degree. But I do hope to increase my salary so that I can afford a more financial secure future for me and my family. In my current role, I do a lot of data collection. I work with clients and coordinate care. I help and improve the health of women and children and serve my community and some of the most vulnerable in my community by working in that field. So a degree in health information management is something that I think is, an obvious next step towards getting a more profitable career and building on my strengths and my interests. My experience in private medical field and public health, I think gives me a lot of entry level experience that will benefit me in the future in trying to go and get a job in one of these career fields. I have included a little snapshot of my resume. I have used this template for many, many years for my resume, and it has served me well. I go and always make sure that if can, at all possible, can make my resume one page. I find that to be the most straightforward and most well received when I'm, job hunting and looking for employment. A lot of my skills are listed there. Some are certificates that I have received and licenses. And I have my information clearly at the top with my objectives and my education following that. And this concludes my project two for this class, my career profile. Thank you very much.